I'm able to record it from here.
Yeah. Okay.
Yeah, so it's
All
okay.
right.
It's okay now.
Okay. All right, so let's get started here then. So thank you, Nick. So I'm a family physician from Ottawa, Canada, and chairing the Medical Women's International Association Teenage Pregnancy Task Force. And Medical Women's International is a 101-year-old organization representing physicians and learners on 6 continents. I'm speaking today with Nick Oketch, who is a chatbot which provides Kenya youth with sexual and reproductive health information. I met Nick at Women Deliver Convention in Vancouver, Canada in 2019. Access to safe, voluntary family planning is a human right and a key factor in gender equality and women's empowerment, as well as important to reduce poverty. Contraception is a human right for adolescent girls. Nick, can you tell us a little bit about the Lucy Bot, what services it provides, who uses it, and where it is used?
Okay, Doc. Thanks so much for having me, and I really appreciate it. Yeah, I really appreciate first of all that this friendship has grown since our meeting in Vancouver, which is really important to us and our work here in Kenya. So. The chatbot LucyBot is an artificial intelligence Facebook Messenger chatbot that gives information around sexual and reproductive health to young people here in Kenya. So we decided to design this chatbot because the community we live in is a very patriarchal society where the issues of sexual and reproductive health are discussed in low tones, and they are only discussed by adults. So you find that the youths aren't so much involved into such issues. So we wanted to create a platform where youth can access the same information just like adults, but we decided to be innovative a bit by creating it on Facebook Messenger, a platform which is already very popular with them, and they are using it. So we wanted them to have information through their phones. So that's why we did create the chatbot. And to date, the chatbot has reached over 10,000 young people who have actually asked questions and got specific answer on issues of contraception and also other sexual and reproductive health matters. Yes.
Okay. Thank you. So it's been 6 months now since the WHO declared the COVID-19 pandemic, and the dashboard, the WHO dashboard, reports on September 11, 2020, 28 million COVID-19 cases around the world and about 900,000 deaths. This is a challenging, unprecedented time. Sustaining telehealth and interventions during the COVID-19 pandemic is critical. Adolescents are particularly vulnerable in the pandemic as they are restricted ability to seek services away from home. But there are opportunities to remove barriers, and LucyBot is certainly one of these innovations. UNFPA has projected with significant service level disruptions lasting for a full year, 51 million women would be unable to use modern contraceptions, resulting in 15 million unintended pregnancies. Can you share with us now, Nick, how the pandemic has impacted you and your region in Kenya?
Yeah, sure. The advent of the pandemic has really had huge impact into our work because you realize that immediately there was an outbreak, the government had put down some measures like banning of social gatherings. And our work, involves students, so we have to gather them all the time and talk to them about sexual and reproductive health issues. So that was out, and we were not able to meet these students as we were meeting them before, to share with them the issues of LucyBot and how they can access the information through the platform. So I think to us, we have had the problems, yes, of physical meetups, but we have seen actually influx in young people coming online to access the information. You realize that right now they have more time with their phones and they are able to access these online spaces. So I think as much as COVID-19 has really affected the works of advocates of sexual and reproductive health around the globe, I think having safe online spaces like LucyBot has been of great help to the adolescents, because instead of going to the hospitals, they can actually access information on sexual and reproductive health, including contraception issues, through their phones. So the government also had an order that people should not go to the hospital unless they feel they are sick. They were preferring home-based care, and you realize that being a rural area, it brought a lot of confusion. So people are not actually going to the hospital to get the supplies there. And also, we had a shift in focus from the county government. All the shifts now went to the COVID-19, and all other services in the hospitals have been really affected because the county government are focusing on the COVID-19. And yet, all other issues of sexual and reproductive health among the youth should also be a priority. So you realize that COVID-19 has really affected our work, because when you go to the hospital to get these services, they don't get them because all the funds now the country are using to improve the bed capacities in these hospitals, and they are not much focused now on the issues of sexual and reproductive health and also some health matters of the communities around here. So, but the good thing is that since last week, the curve has been flattening in Kenya here, and I think that's a good news. And also, we have not had so much cases like the US and also also in Canada, like what is happening there. And I think that's a good thing for us, because we realize that we don't have very strong healthcare system like in Canada, for example, to contain this issue. So you realize that if this pandemic would have hit us like the US, for example, I think it would have been more disastrous here. And I really want to thank God for this, because we realize that Africa is not so much hit. In Kenya now we have like 30,000 cases, and of these 30, we have 22,000 recoveries. So you realize that we don't have quite a huge number of fatalities due to COVID-19. And also the resources for the country like Kenya, the lockdown, for example, the lockdown has really affected the country, because for a small economy like Kenya, for example, when they impose a lockdown for a month, no business going on and all the other things, they lose a lot of money, and realize that in the long run, the countries get more and more into poverty and also in debt. They borrow a lot to cover for the revenue that is lost during COVID-19. And we realize that this loss, for example, now is trickling down to the healthcare system again. And that has really had a huge impact on our healthcare system, and also access to commodity of sexual and reproductive health among young people, particularly in the rural areas where we live. Yes.
Okay. Yeah. Thank you. Thank you. That's a very, gives a good description of how this had Canada. And I guess my final question really today is, what has the impact been on the availability of contract supplies in your region of Kenya? And can you tell us what your region of Kenya is, or what area of Kenya the LucyBot serves?
Mostly, we work in Siaya County. Kenya is actually divided into 47 counties now. So our main focus is the 3 counties in Western Kenya, that is Siaya County, Kisumu County, and Homa Bay counties. So these counties, actually, I come from Siaya now, and all the neighboring counties have the highest rates of HIV infection. So we decided to focus on these 3 counties first in developing this chatbot, and we believe that we'll get to other counties as time goes, because it's an idea that is easily replicatable to other counties also. So it's our hope that By the time we are done with this, we'll have covered all the 47 counties across the country, because the chatbot works in Facebook Messenger, which is already a very popular platform, and youth are using it across the country. So on the supplies and the contraceptive issue that you have just raised, I think I just answered it in the first question there. We have had a stock out in hospital actually, because of the shift in priority area in the hospital, for example. The government and also the county government down here are prioritizing the issue of COVID-19 more than any other issue now. And that has really affected the supply of the commodities of sexual and reproductive health. Just last week, we visited a facility, and they didn't have any products of any contraceptive products in the rural area here, and this is very, very dangerous. So I believe now with the flattening of the curve and all the issues that are going on, and with the healthcare professional getting to understand this virus more, with the wearing of mask measures, so keeping of social distancing, I believe people will soon get back to their normal lives, and the supply of the commodities in these health facilities will increase, and the youth will be able to get the services when they visit, as opposed to now when they cannot actually get the services because there's lack of these products in the health facilities.
Yeah, okay, well, thank you, Nick. That does give us a good picture, share some information about how it's impacted your area of Kenya and about the Lucy bot and really the place it's taken to West Kenya area to educate teens. This is a fantastic way to use technology to do that, and I like your optimism. I'm so happy to hear that the curve is flattening Kenya, and I hope that it can flat and will improve. So much good information from you here today, Nick, and I just wanted to thank you for sharing that with us. You know, it really shine a lens on the potential impact of the pandemic on women's health issues and the sustainable development goal of reception by 2030. Unplanned teenage pregnancy is a global health issue, a women's health issue, and a human rights issue. So thank you again to Nick Okech from Kenya for sharing all this amazing information with us today. I really appreciate it, Nick.
Yeah, sure, Doc. I really appreciate your time, and we thank you a lot for the hard work that you are doing right now, because you realize that right now you are the frontline workers, and it's like you are getting to the battlefield. You are our frontline soldiers. So we really thank you for that. You continue doing the good work that you're doing, and we hope that very soon we'll get a vaccine to this virus, and everybody will get back to their normal work, and people will be free to travel again.
Okay.
And we thank you.
All right. Thank you, Nick.
Okay, thank you. Bye.
Okay. Turn my recording off.